My name is James Hewitt. I'm a pre-med chemistry major with a concentration in biochemistry with a minor in medical assisting. I've taken all my MA classes from Ms. Hunter because she's excellent. But as a pre-med, it's important to do a lot and try and experience as much as you can in order to prepare yourself for the role of an MD, because it takes on a lot of responsibility and you maintain a leadership position. Anyway, there's a lot that goes into it, and there's a lot about the MA minor that helps you to do that. Okay, so there are two major facets of the class that I think have helped to increase my aptitude to do well in medical school, which is, that's the goal. You got to focus on one thing before the next. So, the first one is content, and the second one is class format. So, the first one is content, and so, an anesthesiologist will start his day on a computer looking at like patient charts and trying to figure out like what sort of anesthetic they're going to use, what route are they going to use, do they have any cardiovascular issues that they need to know about, any other issues, any other pathos, and going over stuff like hematology and venipuncture helps with that kind of thing. And it's nice to just go in knowing, and actually an anesthesiologist is the only physician that I've seen actually do venipuncture, so that's cool. But it was nice to be able to go in class and actually get some practice before you have to do it, so you kind of know what you're talking about. And secondly, contact precautions. Surgeries start really early in the morning, and you do them for hours at a time. So, but you have to know how to like effectively don and doff PPE, and you have to know how to become surgically sterile and how to wash your hands, how long to wash your hands, stuff like that. That's all stuff that we went over that would apply to an anesthesiologist. So it's cool to go ahead and know about that, and you don't really want to look stupid when you're shadowing. So, what's another one? Patient positioning. When someone is in labor or otherwise, and you have to put a nerve block into their spine, it's helpful to be able to quickly, let an MA know what kind of position to put the patient in, and knowing what an MA will and won't know is useful, because you don't want to tell them to do something that they don't know, and then you have to sit there and explain while someone's in labor. That would be unfortunate. Let's see, laboratories. I just thought that was a lot of fun. I just thought it was cool because it gives you like a better understanding of the systems and like the tools that the hospital has at their disposal to better understand like what's going on with their patients and stuff. Make sure there's no more. Yeah, there's probably more, but those are the big ones. Okay, number two, class format. The class format was good because it mirrored sort of on a small scale how we make our way through medical school, how there's half classroom discussion and lecture, and there's half like using your hands, learning kinesthetically. And then I think more importantly almost than that would be the open-ended kind of sort of non-official group work that we did on Wednesdays, because working as a team is so important in every aspect of healthcare. I would say especially if you're going to be a leader as a physician, you need to be able to work as a team, and you need to be able to help to teach people, and you need to be open to input at all times. Otherwise, if you start ignoring what your nurses are telling you, you're gonna stop being a good doctor pretty quick. So being able to listen to other people, being humble enough to be taught, and being able to work together as a team, being able to teach others These are all really important things. I've never met a good physician who was bad at communicating and teaching what they knew to other people. So I think it's really important, and we got a lot of good experience every Wednesday doing that, so that was fun. And it applies also. So, and then beyond that, specifically the things that we did every Wednesday, like the injections that I talked about, and like donning and doffing the surgically sterile gloves. Never done that. I didn't realize there was so much to it. Broke a lot of gloves, but it was fun. It was good practice. Helps me not to look stupid. So that's good. And what else did we do? Oh, mixing the medications. Anesthesiologists do a lot of that. Before a surgery, an anesthesiologist will go in and they will choose which medications that they're going to use, and then they're going to draw them up and they're going to mix them. And you have to be able to draw up the right amount. That's just, you have to be able to do that. And so being able to work, practicing doing that was very helpful. And then also the different kinds of vials, the different kinds of containers that medications will come in, the different kinds of needles. I didn't know that there was a filtration needle for the glass vial that you have to break open, so that's cool. Yeah, so that's number 2. That's class format. That's how it applies to becoming a doctor.